Human and Social Services meeting to order. We're overdue, so we'll get started. Okay, first thing we need is a motion to approve the minutes of last month's committee meeting. Motion by Mr. Lowe, seconded by Mr. McGowan. Any additions or corrections? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. Chris and Julie, come on over.
So your head feels okay now?
Yeah, you still have a little scab there, but thank you. But I want to thank you. Get your bell rung at 6:30 in the morning, you know.
Thank you. Thank you. How are you?
Blood.
Is this before you went to the gym or after?
No, this was before I went to church. I was on my way to lecture, okay, at St. Mary's. Sent me home. Like I was ready for the task.
I've been lucky. I have not taken snow this year.
Yeah, and you know, I cut my hip. I had my left hip replaced 4 or 5 years ago, and you can see where the pressure is felt on your body, and how someone gets a fracture. You know, it's got like.
Oh yeah.
All
Good
set,
you were
Chris?
here.
Good morning, everyone.
No, I crawled to my car to, get off the ice.
I think we'll start with the personnel items that we have for social services. We have some request resolutions to fill some positions. The first one is intent to fill a position of part-time assistant social services attorney, which would be no more than 20 hours per week with an annual base salary of $34,260. This is due to a resignation effective February 15th.
All right, I think we'll put all three of those together, so if you want to.
Go right through them?
Yes, please.
You got it. The next one is a notice of intent to fill the position of social welfare examiner, number 43, in the temporary assistance unit. It's a grade 8 with an annual base salary of $33,600. This was due to a promotion effective March 11th. And the last one under social services is a notice of intent to fill the position of social welfare examiner 17 in the Medicaid unit, which is also a grade 8 with an annual base salary of $33,600. This was due to a promotion effective March 11th as well.
Someone like to make that motion? Supervisor McGowan, seconded by Supervisor Driscoll. Now, any questions? Supervisor McDevitt.
Yeah, just a question relative to the assistant social services attorney. The salary for this part-time position, is that consistent with the guidelines in terms of what our attorneys are going to be paid going forward?
Yes, I discussed this with Ryan Moore, and we went over the salary schedule, and this is based on the base salary for the social services assistant attorney, 50% of an annual salary. So basically we took the annual salary from the new schedule, divided it in half with no more than 20 hours.
Thank you.
Yep.
All right, so-
Any other questions? Supervisor Sokol?
Yeah, thank you, Madam Chair. On the sheet here, Chris, it shows the salaries, but on the forms, it's a different base salary for this. Is it inconsistent, or am I reading this wrong?
There could be a difference because sometimes people might be at a different step when they leave. I haven't seen that actual form. I think...
But, no, like, you're showing $36,000 here for the assistant social services attorney, but on this sheet it's showing $34,260. And then I guess the same with the other two, $34,988. But on the sheet here it says $33,600.
All right. The base salary should be the $34,260. That is based on the current schedule that was just worked out.
Okay, so are we changing it on the form then here?
Yeah,
Should it
so
read
the form should read $34,260.
then the other one should read 33,600, correct?
Exactly.
Okay.
Thank you for
Thank you.
noticing that, Supervisor Sokol.
That's what I do, my friend.
All right, Supervisor McGowan.
Yeah, just because I brought this up before, and I said, so this is actually, because last time it was based on a salary, and, you know, and I misunderstood it, because I'm like, why are we paying this much, but it's half-time? But, so this is, so actually, this would be 68,050 or something, right?
Yeah,
You know,
yeah.
60, so, all right, so it is half, because usually, you know, they say with a base salary, they give you the full year, but you're only using half of it, then,
50%,
you know,
yeah.
50%, because I missed that last time and I was wrong, so, all right, that's fine, thank you.
Chances are it could actually be less because there might be some weeks when they don't work 20 hours. So it's possible that throughout the year it probably actually will be less, depending on workloads.
And that is based on, like I said, of what we just talked about with the new salaries coming up with the,
Yes, that's what Chris said. He had
Right,
talked
and
to
this is-
Ryan about that.
Yes.
All right, Supervisor Driscoll, did you?
No, I'll...
You're all set?
Yeah, I'm all
All right,
set.
any other questions? All right, all those in favor? Opposed? Carried. Thank you. Chris, I think we'll do the same here with Countryside Adult Home. We'll just go through them all, and then I'll leave it open for questions, if that's all right.
Okay. We'll move on to Countryside then. These are personnel items. The first one is to request to create and fill position of part-time temporary senior aide, grade 7, for an annual base salary of $33,600 for a period of up to 6 months, to be reviewed in 6 months. This is in regards to a retirement and an opening that we had. This person would be helping to train the replacement person for the position, which is located below as well. The next one is notice of intent to fill the position of part-time temporary senior aide, grade 7. Then we have a position of institutional aide, number 12, due to a retirement. It's grade 3. We'd like to fill that position. Base salary is $28,026. We had a retirement effective March 1st there. And moving on, we have a position of institutional aide per diem, grade 3, due to a resignation, effective March 4th. And the next one is to fill a position of food service worker, grade 2, due to a promotion, date to be determined. The rationale for a couple of these positions, especially the last two, is in regards to the fact that we have been paying overtime for people to work out of title in some of these areas, and it'll balance out the staffing needs a little bit better up there. So, you know, it'll be helpful for Countryside in a number of ways.
All right, someone want to make the motion to bring this to the floor? Supervisor Sokol, seconded by Supervisor McGowan. Mr. Sokol, question.
No, I just wanted to make the motion.
Oh, okay, good. And I did notice that he said the positions are mandated and reimbursed, so.
Yes.
Okay. All right, questions? Supervisor McGowan.
yes, I understand the retirements, but some of the resignations, and in the past, I know your department's huge, and I appreciate all you do, but are we, people leaving the money? Is it stress?
I think it's a combination of those things, and that's something that I'll touch base on a little program that Tammy Breeden and myself were involved this past month in regard to some of those issues. We did a webinar and a training on that very issue, because it's a problem everywhere in social services and human services in general, to recruit and retain employees. A lot of times people will get these type of jobs just as a filler until they can find something better. A lot of people are seeing that, especially with these part-time or per diem positions. that really don't pay a whole heck of a lot. So we do see some movement. The good thing is that I think it's getting a little bit better, and right now a lot of our positions are filled. We obviously have a lot on this agenda, but moving forward, we're hoping to see some improvements, and we're doing a couple things at DSS right now that we hope are going to lead to better outcomes as far as retention.
Thank you.
Right, other questions? All right, then we'll call the question. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, number 3 is a request for resolution with permission for the Department of Social Services to enter into a contract with HMIS, which is the Homeless Management Information System that's been created by the state. This is to provide various services related to temporary assistance working with homeless in our community. This is in regard to reporting and collecting data, making referrals, and generally trying to improve the process and having access to more information that will better support the work that we do in those areas. If you remember, at the last committee meeting, I had asked for a position for a person who will be working half-time at Countryside and half-time at DSS. This is a system that person would use at DSS to help out in those areas to improve our work with the homeless. This is for a term commencing March 1st through February 29th of 2020 for a total amount not to exceed $5,000. That's the initial first year. The second year, they will be lowering that to $3,000.
All right, someone like to make that motion? Supervisor Driscoll. Second to the motion, Supervisor Loeb. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, the next resolution, we are requesting an authorization to pay the New York State Department of Health for a fine in the amount of $2,673. This was as a result of some minor violations that were cited in reports of inspection for Countryside Adult Home dated August 17th, 2018 and December 20th, 2018. It's a New York State Department of Health directive, so it's something that we need to pay within the next 120 days.
All right, motion to bring that to the floor, Supervisor Loeb, seconded by Supervisor McDevitt. Question, Supervisor
Yes,
McDevitt.
what specifically were the minor violations?
I was wondering that, too.
Yeah, I can speak to that. The first one was in regards to, this was in the summer of 2018. DOH requires CRH forms to be filed. Those are criminal history record check forms. And when they were doing an inspection last summer, they noticed that there was some forms that were missing from some employees' files. Actually, it was one employee's file. They had said, we talked about this before, there was a corrective plan put in place, and there was still one missing from a file. Staff there and the deputy commissioner has since gone through every staff file to make sure that these are in there, so that we have taken corrective action from there. We have a new hiring procedure policy where this gets done immediately and placed in the file immediately. It's part of the intake packet when someone comes in as a new employee. The staff files are located in the director's office now. They're locked up, and the director will be looking at these very closely from day one. So that was the first one. The second one was in the fall of 2018. There was an inspection on the 23rd of November, and a staff person had touched the back of a chair while she had her gloves on. and did not change them and return to the kitchen, and that was cited as a violation. So in regards to that, we have had a new in-service training again and provided handouts. We now do in-house audits. The director will be observing randomly during meal times and recording a log of whenever she does inspections or if anyone is spoken to.
In terms of the specific criminal allegation, what was the allegation?
There was no criminal allegation. It was just that the form was not in the file. So what had happened is that anytime there's an employee hired at Countryside, we have to do a background check. And then the form, which actually I think I have one with me, there's a form that gets filled out, and pass that around if you'd like. That's the form that needs to be filled out and placed in the employee's file. What had happened is during that inspection, it was missing from one of the files. So they cited us on that. It was done afterwards, and of course, there was no criminal background check came back clean.
Okay, so I understand now. So there was not a criminal background, it was the form, wasn't it?
Exactly. It was just
Okay.
the criminal background
Good,
check
thank you.
form was
Yeah.
not in the file.
Thank you.
You're welcome.
Any other questions? Supervisor, oh, McGowan, I'm sorry.
We can't, you can go to court sometimes and, you'll get it reversed because, you'll fulfill the obligations, and I mean...
I'm glad you asked that question because I did look into that, and we were initially told that the fine would be $14,000. So we were able to
Good
negotiate
negotiations.
that down to the 2,000 and something. So we did work on that, and we kind of pushed it a little far, and they started getting a little annoyed. So I said, okay, we're happy. But
you
yeah,
for your-
we tried to negotiate it down to nothing, and we were unable to do that. They did say that they were required to have some sort of fine indicating that there were findings. So thank you for that question, and we did. We tried to
Tried your darndest. Well, good.
try to
Thank
get
you.
out of it completely, but we were unable to.
Supervisor
Thank you,
Driscoll?
Madam Chairman. Chris, municipalities oftentimes are cited by state agencies like DEC for stuff that just happens. Are you aware, or any of my colleagues who have been around here, aware that this is something that just, routine happens every few years, or, is there a history of these types of citations occurring up at Countryside, or that you're aware
There's
of?
none of these that have happened. I know that several years ago there was some sort of incident, which I'm not really familiar enough with. It was before my time to discuss, but I know that, occasionally they do find things. I think it would be next to impossible not to find something. There's a lot of areas that they check. The audits and reviews are, they're pretty significant. They go through a lot of different things. As you can see, they go from, these two things couldn't be further away from, one's an administrative piece of paper, the other one is actually someone just didn't change their glove and before they returned to a kitchen. So, there's a wide range of, things that are looked at that could result in finding something. So yeah, we do have these quite often. Usually we don't have these issues, and hopefully we won't going forward. I really don't think we will
Great. Thanks.
have these type of things happen again.
Perfect,
But
thank
you
you.
never know.
Yeah.
All right, question, Mr. Soper?
Thank you, Madam Chair. Chris is absolutely correct, and it also could depend on the inspector that you have. They could have a really bad day, and they can knock your socks off, and I've dealt with a lot of them over the years, and sometimes you get some really tough ones, sometimes you get some not so tough ones, but ultimately, it's true. They can get you for anything, at any given time.
All right, any other discussion? Any other questions? All right, then we'll vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. Number 5 is to request to renew a contract with Jennifer Linehan, a dietary consultant for dietitian services at Countryside. The period would commence March 2nd, 2019 through March 1st, 2020, for a total amount not to exceed $3,840. The contract did expire on March 1st.
Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor McGowan. Any discussion? Any questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
And then the last, number 6, request resolution that I have is to appoint 2 members to the Warren County Youth Board for the 2019 calendar year. The first one is Josh Patchett from Hague, and the second one is Susan Shepler from the town of Thurman.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
And that's all I have, other than an update on some things that are going on at DSS. Maybe we'll let Julie go first, though, with the fiscal.
I ran the revenue and expense report for 2018. I'm not sure if you had a chance to look at it, but pretty much we came in under budget, and revenue is actually pretty good for our expenses that are down. It pretty much wraps up 2018. There'll be a few expenditures and possibly a little more revenue, but all in all, that pretty much will wrap it up. And I did run just the top report for 2019 for February, and beginning of the year is really kind of hard to tell where we're at, but revenue tends to come in a little slow at the beginning of the year, and our expenses are right where I'd expect them to be. And for our overtime, it's still up a little bit. We have a couple of caseworkers still in training. Once we get them on board, hopefully our training and our CPS overtime will go down a little bit.
Questions from the committee? Supervisor
Thank you,
Loeb.
Madam Chair. On the revenues versus the expenses for 2018, why are the revenues and expenses budgeted not the same?
The revenue is based on a certain percentage, which isn't written in stone, different areas, different grants, that kind of thing. So you get an overall, and I base it, I think, on 77% reimbursement of expenses. So if you look at our expenses, really our revenue came in a little bit higher than that 77%. So
I guess what I'm referring to, so these revenues are a particular type of revenue as opposed to all revenues which would come from the general fund, New York State, federal government. I mean, it's all the funds that come in order to pay these expenses. Where what I'm going to is our expenses are $1.5 million. Is that $1.5 million, is that money that New York State has saved, or is that actually going into Frank Thomas's budget?
I believe any monies that we do not expend will go to the general fund.
Well, okay. Thank you.
Any other questions on that? All right, then we'll go back to you, Chris.
All right, just have some updates here. On March 1st, I hosted the Warren County Interagency Collaboration Committee meeting at DSS. There was a presentation from Northern Rivers in regards to their mobile crisis unit. We were updated on the mental health and education project that we're undertaking with the school systems. And Under Sheriff Sean Lamoury gave some updates on the Sheriff's Office and jail and some of the programs that they're doing in regards to mental health and substance abuse as well. On the 6th of March, Tammy Breen and I met with Amanda West from the Council for Prevention. We're updated on some information regarding youth court programs and funding. Apparently there's some big changes coming from OASIS that may significantly affect their budget, so we're going to try to work with them to maybe ease that pain in 2020. Julie was in on that meeting as well. On March 7th, we had a child support enforcement review team come from the state. Jennifer Nye led that for the Audit and Quality Control Unit. They discussed and reviewed security awareness and compliance. Went very well. They had a couple of suggestions, but they were overall very impressed with our security protocols in Warren County, especially in regards to FTI, which is federal tax information, which is obviously highly confidential information. They're going to come back in about 3 years for another review, we look forward to that. Things went fine, and a couple little things that we're going to change. We weren't cited for anything, but it went pretty well, and it was all day long. To reiterate what Supervisor Sokol said, they are pretty exhausted in some of these, and there was 4 people in that team, and they were there for over 8 hours going through everything. On the 8th of March, Tammy Breen and myself attended a STAY webinar that addresses recruitment and retention of employees. I mentioned this a little bit earlier. The specific topic was assessing the culture and climate of an organization. We learned how to create a survey that would provide data to help with some of these issues. I was unable to attend the whole webinar, but Tammy Breen did attend the whole webinar and has already taken the lead by creating our own DSS-specific survey, which we're going to do throughout the organization. And we really learned some good things from the webinar to get some honest feedback from employees to find out what we need to do. And obviously one of the things is salaries, but that's limited what we can do there. But there are other areas that we can work on that don't involve fiscal matters. My personal opinion is, I think a lot of people here, I know that Supervisor Bramer has brought this up before, is that living wage is what it is, and a lot of people aren't. If the vast majority of people that work for DSS qualify for benefits of some sort, that is an issue. So it's something that we're working on. We're going to find out what we can do to further improve retention and morale. We have had some really actually good activities lately throughout the building that people seem to be enjoying. Pizza parties and raffles and what else have we done? Bingo and karaoke, and this is all at lunchtime. This is on breaks. This is not going on throughout the day. Trivia. Yeah. So
fun.
yeah, and after work we're trying to work on some of those things. I think it's healthy. People are I think a little bit happier to come into work when some of these things are going on, and they're getting to know other workers, more on a personal level. Not that everyone needs to be friends outside of work, but it's nice when you know a little bit more about other people. We're also posting on people's birthday a list of things that they like to do, and their interests, and some things about their family. So it's interesting learning more about the people that do the work at DSS. So that's been going well as well. On March 11th, Philip Perry started as our lead DSS attorney. So we were glad to hire him. He had previously worked for DSS, and he came back and has already jumped in and working on some interesting stuff already. That's an area that I believe I've discussed before at committee in regards to improving some of the areas within our legal unit to actually have it a little bit more structured and have more policies and procedures that lend itself to better representation in some of our court actions and stuff like that. We also are looking at improving some of the work that we do in Medicaid and in our resources unit to try to improve in those areas. So we're really happy to have Phil back. He's a very talented attorney, very smart man.
Good.
On the 12th of March, we had the quarterly Warren County Risk Management Committee meeting at DSS, and that was, there's members from every department within Warren County on that. On the 13th of March, Deputy Commissioner and Tammy Breen and myself met with the Salvation Army to discuss their programs, work on a plan to work more collaboratively with referrals back and forth, and I hope to get down there and go for a tour of their building. On the 14th of March, I attended the statewide commissioners meeting in Albany. We were updated on changes in Children and Family Services, Medicaid, temporary assistance, homeless initiatives, and Raise the Age, among a few other things that I won't get into. We did have an interesting guest speaker, though. It was Mike Hine, who has been newly appointed by Governor Cuomo as the new Office of Temporary and Disability Assistance Commissioner. He was previously the county executive in Ulster County, so it was nice to meet him. Seems like a really nice man, and certainly has worked closely with DSS in Ulster County before he took this position. So it's going to be helpful that someone who actually knows what we do is really going to be involved in the process now. On the 18th, we hosted the Warren County Youth Board meeting at DSS. Catherine Chambers from the Council for Prevention discussed vaping trends and dangers. Madam Chair, you were there, and Supervisor, you were there as well. So we, I think we got an earful and an eyeful. It was interesting. They actually brought some vaping devices in and passed them around and showed, when you have one in your hand, you can kind of see why kids are attracted to these things, because they're kind of, they're cool, they're tech. So a kid gets a hold of one of these things and they see these other, substances that they use in them, and it's really a great marketing thing. It's terrible from a health standpoint, especially with some of the things that we learned about kids who get involved in vaping. Sometimes it leads to them actually smoking tobacco products, because tobacco products are still stronger than these vaping products because of the way that tobacco companies have enhanced tobacco products, especially cigarettes, over the years to have more nicotine in them to get people more addicted. So it is going to be a project that everybody's aware of and is working on in the schools and throughout the county. So that was an interesting presentation. Just a quick update on Countryside. That's my last thing, I promise. We did offer the director position to a candidate, and that offer was accepted. We're just waiting on final approval from DOH on her credentials, and we are certain that there will be no issues with that. So hopefully at the next meeting I can report that we do have a director at Countryside, and the census is now at 35. Actually, it's really at 36 because we have one in rehab who will be coming back, but the census has stayed pretty much at the same level it was last month, which is, I think, the highest level we've had in quite some time, so we're happy with that.
I guess so. Well, thank you for your report. Mr. Conowar, I saw you, but I thought I'd let him finish his report first.
Just really two things. First, these lofty levels, congratulations on 2018 budget. It's by a little, you miss by a lot. You know, every 1% is $330,000, so it's a lot. Frank and his budgeting well to come in. And then on the revenue side, to project down almost $16 million worth of revenue coming in, a fraction of a percent is applauded. And that's, my experience is that that's usually more the result of good management and following your finances than it is luck. So congratulations on that. Well, you can imagine if they missed by 3%, we would have to find $1 million. So congratulations on that, and then also thank you for the communication that went out on Countryside. I did get back to the head adage on that, gave her my thoughts on that, and I would encourage any supervisors that have any thoughts on the capital plan that's being put together for Countryside to communicate with the department or communicate with the consultant.
Thank you for that, and you're welcome. I would like to add that Julie does do a fantastic job. She really is very articulate and will not hesitate to let us know if there's some issues, which is much appreciated because that's exactly what I need for a fiscal manager and what the county needs for a fiscal manager. Her unit is amazing, and we've had a lot of issues in the unit with staffing, none of which are Julie's fault, but we've been working on that, and the work has been getting done, and I think we're going to be just fine in that unit. We've had some really good developments the last week, so we're pretty happy about that. So we look forward to continued good work by our fiscal manager in that unit.
Well, it sounds like things are going well in that department, and we're really pleased to hear that. I need to I'll go back to the first page of the agenda for a minute, back to the notice of intent to fill the position to social welfare examiner number 17 in the Medicaid unit, right, Amanda?
Yes.
Right. We had like 33.6, and Amanda said that figure should be 34,988, and it is a grade 8. So instead of the 33,600, it should be 34,988. And it's right on this form that got turned into. We just want to make sure you have the right information in front of you.
Okay, my apologies for that. We will amend that and make sure that that's correctly submitted.
Okay, thank you very much.
Thank you.
Thank you both.
Very good
Thank you.
report from both of you. It sounds like after almost a year there, Chris, things are going quite well, and I think your idea of what you're doing on your lunch hour is a tremendous idea.
And we're trying to boost the morale, and really have people wanting to come to work.
That's great.
As you know, a lot of the work is not the most pleasant some days, but
Right.
We have good people, and hopefully we'll be able to retain more as we move forward.
Okay, thank you very much.
Thank you.
Yeah, I can mention that. Yeah, my gals must be out there, don't you think? Yeah.
We probably should have stayed with the 9 o'clock start time. So we'd have an hour.
I don't feel comfortable.
She's out there. 10 o'clock.
Oh, good.
They were just in the hall.
Thank you. Fine, and you? Swear, I run off more copies. Well, look at this. That's one copy.
We'll do it. Thank you.
Thank you.
not everybody likes these.
Really? You like that?
You like that.
It's amazing. Okay, well, a chair for everybody.
Give me a barrel. Give me a barrel to sit on, I'll be all right.
This looks like a pretty controversial agenda. Good morning. All right, we're still on health, by the way.
Oh, we are? I don't...
You can...
Okay, I think Janelle is all ready, so if we could kind of give her our undivided attention, we could get started, please.
All right, first is to request a resolution to authorize Laura Monroe, a nurse, to receive reimbursement according to CSEA union contract for job-related course. She'll be taking a diversity course, which is related, she gets to see her better. We're looking for reimbursement for that. This course is required for a Bachelor in Nursing. It also will provide the nurse with understanding critical thinking and experience related to cultural differences, which is very important.
All right, someone like to make the motion, Supervisor Loeb, seconded by Supervisor McGowan. Any questions? All those in favor? Aye. Opposed? Carried. Thank you.
The second is to request a resolution to authorize a contract contingent on full New York State licensure with Amanda Rose Mastro-Petro, New York State limited licensed speech language pathologist, to provide speech therapy services for home care and preschool programs at the established rates, which are attached, in attachment 7. We're also requesting that we get automatic renewal unless there's 30 days written termination notice.
All right, someone like to bring that to the floor, Supervisor Sokol, seconded by Supervisor Loeb. Any questions? All those in favor? Aye. Opposed? Carried. Thank you.
The third is to authorize the Director of Public Health to apply for a $1,500 grant, actually a prevention agenda project application through Adirondack Health Institute, and enter a contract if the project is approved. This resolution is needed to submit the application, which is due April 12th. The grant will expand efforts that we made in a previous grant by allowing fresh fruits and vegetables to all WIC locations. Currently, we're serving 5.
All right, Supervisor Driscoll will make the motion, seconded by Supervisor McGowan. Any questions? All right, we'll call the question. All those in favor?
Aye.
Opposed? Carried. Thank you.
Next, we're looking to request to amend an existing contract with Waystar Zermed Inc. and Public Health Immunization Program to reflect a 5% increase in our monthly claims management fee, which is currently at 35 cents per claim, and it'll go up to 36.75 per claim, and a 5% increase to our monthly electronic remittance advice, which is ERA fee currently, which is 25 for 500 ERAs per month, going up to 26.25 for the 500 ERAs per month. ERAs in excess to that 500 requests will be billed at 0.07 each. This Zermed account is with our public health immunization program. You might remember last month we asked for an amendment in the contract for our home care side. Because we already do have an account with our home care, they did waive the annual fee, which is good. But this service is necessary to ensure that when we do billing that it's efficient and they're not denied.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. Any discussion? Supervisor Leggett.
Thank you, Mr. Chairwoman. How many immunizations are done?
I don't have that number off the top of my head. I will say that we do have some of our immunizations are private pay, but this is more like the flu season where we do our Medicare billing and making sure that we have everything that's up to date. It's way less than 500. So we don't usually have to do the .07 in excess of 500.
Any other questions? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
Next is a request for resolution to amend the county budget to accept Adirondack Health Institute grant or the Prevention Agenda project application, should we be awarded. And we'll let Sandra select for that. That's attachment number 9. That's your budget amendment.
What we requested for this grant is basically $1,450 to go towards foods that will be purchased, and then supplies of $50, and showing that then we would get the $1,500 grant for that, for the food bag program. All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor. Like, I guess they're falling asleep already, Supervisor Young. Any questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
All right, there are no referral or pending items, so jumping for information for discussion and review. First is our report of expenditures and revenues. Second is the comparison report, which are attachments 1 and 2, which Tom will discuss.
Attachment 1 are our financials as of March 12th, to give you an idea where we stand current year to date, and again, just to mention that 2018, of course, is not closed yet, so we still are waiting for WIC and our preschool numbers that takes a couple months before we get those. Regarding our salaries, looking at this year to date to last year to date, we're still under in regular salaries compared to that, because we have a few positions that are still open. And our overtime, again, it's last year at this time we did not have this new crescendo system. We do now, and again, it's the documentation regarding that. And that's not all of it. We do with the nurses work weekends, and they have overtime automatically with that, and they've worked, that's guaranteed. And our part-time salaries were under a little bit, and that's basically our per diems that we utilize on a monthly basis. Our next attachment 2, which is our comparison with everything from this year to last year as of March 12th of last year. Again, the salaries are reflective of what you see. We're under about almost $30,000 from last year. Equipment stayed the same from last month. Contractual expenses is the big one you're looking at. That's our expenses. Again, I have to reflect that last year, or last month I mentioned the rent expense. We haven't received the rent bills yet that we have to pay, so that'll probably, hopefully, will be in the next month. That's $116,000. And then in comparing our home care contract people, the therapists that we pay, and our therapists that we pay for the preschool programs, again, it's timing and billing just due to when everything hit right now, because we're looking as of March 12th. That was over $270,000 difference from last year to this year. So those two things alone are 94% of what our budget is. So I mean, I can account for it and say what it is. It's just due to timing of the bills and trying to get that in. Employee benefits, again, slightly down by $31,000, again, reflected with our positions that we haven't filled yet. And then revenues, slightly under by $34,000. I will say that our WIC program, January's closed, I was able to just submit that voucher, and that was close to $30,000, so they're almost about break even compared to last year. So revenues right now are pretty stable. And that's what I have. Any questions on the financial part? All right, we'll go back to Janelle.
Okay, next we have status of referrals, which is attachment 3, and Val, our Assistant Director of Patient Services, is you do have that attachment, like Janelle says, is attachment number 3. We are down minus 47% for this month, but if you go back and you look at last month, the little chart that's below, we were minus 27%. And I think where we ended up with that fluctuation is we've got still 2 systems kind of going, and when things are finishing off in one set. And unfortunately, a big part of the status of referrals is because of what's, going on with our local hospital. That's where we get the majority of our referrals. We are getting more referrals from Albany Med, Saratoga, St. Peter's, and definitely a lot from our local physicians. But, usually the bulk of them, are from the hospital. And even though the referrals, our numbers are down, our staff they're just chasing their tails running. We have more regulations by the state, more documentation that needs to be done. And, so we are busy even though the numbers are down. And we did hire 2 staff members, and one did resign after a week.
Oh, Okay, guess that job wasn't for them, huh? Mr. Loeb, did you have a question?
Yes, I do have a question. Other than the closing of the rehab unit, what referrals would you be getting from the hospital that you normally would get?
Oh, we get, patients, congestive heart failure, coronary artery disease, diabetics, wound care, surgicals, a lot of not any, but a lot of the patients that are elderly get sent home with home care referrals, and where we do disease management, teaching, physical therapy, occupational therapy, speech, nutrition, so they just don't, they're just not discharged from the hospital out by themselves. Then, we get all the referrals to go out and take care of them and teach them how to manage their own disease processes.
So that would be proportional to the decrease in census that they're
Yes.
currently.
Yeah, and I believe there was a short period of time in February, I don't think it was a full week, but their census was 99, and, that's quite low. And they have more patients. We're all required by regulations to ensure a safe discharge, and, we tend to have a lot of elderly population, so more and more patients are now going from hospital to rehab as well. Just everybody has to ensure that they're doing a safe plan. So they're all looking out to prevent these patients from going back into the hospital. So if rehab helps to get them a little bit stronger, otherwise if they go home and then they go back in with the same diagnosis over a short period of time, that's not good for the hospital.
Thank you.
Did you have a question, Mr. Driscoll?
No, I didn't.
Oh, okay. All right, thank you very much.
All right, also for review is emergency response and preparedness is attachment 4. Our rabies report is attachment 5. Another informational item, attachment 10 is a request to hold a meeting that was approved. That was the light lunch that we provided to the Board of Supervisors after the meeting on Friday for the T21 Lunch and Learn, which was approved. Nursing positions in March, we had 2 resignations, a registered professional nurse 31 and a registered professional nurse 37. There are currently 4 vacant positions within PA and 1 in our public health. And so we put in 2 intent to fill forms to reflect the 2 recent resignations.
All right, so one is for the registered professional nurse number 1, and the other is for professional nurse number 37, is that correct?
Right.
Okay.
One is in the public health for maternal child, and one is in our home care.
Okay, so I need a motion. Supervisor McGowan, seconded by Supervisor Driscoll. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
And that's all I have.
All right, any committee member have any other question? All right, anyone in the audience have a question? If not, oh, all right, we're good then. I'll entertain a motion to adjourn, I guess. Okay, Supervisor Loeb, seconded by Supervisor McDevitt. All those in favor?
Aye.
Thank you. Thank you, ladies. No.